So just to recap a little bit from last time, and then to launch into tonight, what you told me that is that you'd prefer to have more discussions around clinical case material and applications, and less on theory. So I'm going to help you. Hopefully, I'll rely on the fact that you're going to read the material for the theory, and we can have more discussion in these times around how you might apply the material to, the cases you're seeing or anything else. Is that about a snapshot of what we discussed last time?
Yes.
Okay. So, in a real quick recap about Freud's model of the mind, is that really, when you're sitting with a human being in front of you, you want to think in terms of how this person presents as a cacophony of opposites and contradictions. That the psyche is very, very internally divided and split in a variety of different ways. And this notion that everybody has it together and there's this unity and there's this continuity of thought and feeling and fantasy and action, in and of itself is a fantasy, or it's a transference to theory in many ways. You're all in your own analysis, so you know what it's like to be struggling with competing agendas in your mind, just like patients are. So in many ways, we, from a Freudian point of view, from a classical psychoanalytic point of view, that we should not lose sight of the fact that we have a dialectical relationship to our interior. And the dialectic is that there's always a interaction, an ongoing an ongoing conversation or dialogue. In fact, that's what Plato said about thought is, thinking is, like the soul is about the silent dialogue that the mind has with itself. And because of that, there are competing agendas. And Freud introduces this, certainly from antiquity it's introduced, but into a more modern scientific psychological point of view. Let's leave out science. I shouldn't have said that. That's another matter altogether. But from a logical point of view, that people are internally divided. We wouldn't even have a term called splitting if that wasn't true. So we split all the time. The ego splits itself. It divides itself. It is in opposition to everything that stands outside of itself. So the notion that if we look at dialectics, not necessarily binaries, not necessarily dualities, like a dualism, but oppositions. These oppositions are in relation to one another at all times. So on the most basic level, you have an unconsciousness and you have a consciousness. Of course, you have a tertiary or an intermediate or meso domain that he introduces as preconscious. You have primary process thinking, which is dominated by instinct, if you want to use that term, by the drives, by desire, by base impulse, what the French would call pulsions. And then you have secondary process thinking, which is more about the evolution of the sense of self or the ego that has to deal with the external world. You have the pleasure principle, which is all about gratifying wishes and desires and immediate gratification or satisfaction of urges, versus the reality principle. And the reality principle makes itself known when you're outside of your family. Or it makes itself known inside the family, but I mean, there are all these forces that are outside. And so the psyche has to accommodate all these things. You have both irrational and rational aspects of who we are. You have the notion of libido, lust, pure desire that's unrestrained, that's unbounded. A very important part is about desire, is that it's in principle unbounded. It just is a flow, but it always appears bound. It always appears attached to an object or to a thing of gratification, even if the thing is in fantasy. But then what do you have? You have the development of the ego that says, we can't just gratify anything we want at any time. There's consequences because it obeys reality principle. And then you have the superego that says not only can you not have that, can you not gratify that wish, that primordial desire, but you should be punished for it. It's immoral. So all these checks and balances in the mind are at play. And we do owe this to, in a large part, to classical psychoanalysis. And we will see it time and again, in the consulting room. What are people divided by? What is their source of conflict? And it's often there's tensions of opposites. And how do they play out? On one hand, some people develop certain defenses that allow them to dissociate, deny, compartmentalize off certain aspects of their psychic reality, and they focus on their lived experience or what they want or crave, and that drives them. Others are driven by self-restraint, and they sacrifice certain things such as pleasure and happiness. But psyche likes to seek balances in many ways. It likes to seek compromises. But the most important feature here is that, and this is a presupposition, the presupposition is that you have the ontology of the unconscious that is operative at any given moment, even right now among us all. You might be consciously attuned to what I'm saying. You might be drifting off in your own little fantasy land. You might be thinking about when you're going to get home tonight. You might think, I just have to be here to sit through this hour and 15 minutes or whatever it may be. Or, you may be more attentive to what I'm trying to say. But you have divided attentions. And because of that, you have internal fantasy systems and streams of thought and consciousness that are, operative on parallel process systems. Now, this in many ways is complex, like anything is. So when we start thinking about there might be an aspect to the psyche, to the mind, that's hidden, but yet it's operative at all times, and it reveals itself. And it reveals itself in different ways. That we'll be looking for that in our work with with our therapy work with patients in ways differently than we would in our conscious daily lives that go about, based upon goal-oriented activity, and I have to do this and I have to do that. So often the mind unconsciously wants to communicate itself. And how does it do that? It does that through everything from the slip of the tongue, the pen, the faulty achievement, the bungled action. It's only on the condition that it was an accident that someone could have said something offensive, or that someone could have thought something immoral, amoral. That these things communicate something about our conflicted nature. You lock yourself out of the car on an important day where you have an interview, and you don't make it. It's only on the condition that you have ambivalence about the whole thing that this would happen. That's a speculation. Think about those accidents that you've had in your life. I mean, we've all had them. We have them all the time. It's amazing what comes out of our mouths. So that is, a benign element of the unconscious at work. Freud called it the psychopathology of everyday life, even though I wouldn't call it psychopathology. Dreams, obviously, in our dreams, we're confronted with a plethora of things that don't make sense, or they're affectively laden, or horribly imagistic, or symbolic, but yet they don't make ready sense to us. The notion of symptomatology. Symptoms emerge. They emerge because there haven't been internally mediated ways of reconciling conflicts between, oppositions. So every symptom is the presentation, of an unresolved conflict. Yet, as Freud says, there's a sense to a symptom, meaning that it presents itself sensuously, but it also makes sense. That when you have internal oppositions that can't meet with resolve, they must find a compromise, a conversion, so to speak. And that's what pops up in the symptom, in the dream, in the fantasy, in the slip. And these are interesting phenomenon that we encounter, day after day. If the more you become adept at your own self-analysis, you'll see it in yourself. So, leading up to tonight's talk has more to do with anxiety. And I remember last week asking a question about what are the two leading elements that people are conflicted by, and one of them was anxiety that you mentioned. Another one was loneliness, I think. But isn't it interesting that we live in an age where, quote, anxiety disorders, depression, trauma, these seem to be the three main things that people present when they come in to see you for therapy. So from a psychoanalytic point of view, anxiety is certainly different than a physiological point of view or a medical model point of view. Medical model would more or less say this is the physiological features that have to be present before your body feels a certain reaction to it, and they may even put the origin or the cause or etiology of anxiety to be something either external or genetic. You're predisposed to experiencing this. Well, from a psychoanalytic point of view, it has more to do with how the psyche comes to configure itself, as well as how does it respond to its environment, developmentally, ontologically, meaning structurally, and phenomenologically. That means how does it experience its world. So the notion of anxiety is so central to everything that we do. I mean, we live in an anxious world. How does a person come to understand the anxiety? Like one of my patients yesterday, I've seen her for, since 2002, so 18 years. I'm still shocked that she's not aware of certain triggers and connections. That's because that she wasn't really brought up in a family that was educated, that fostered self-reflection, and she seems to be very much mired in a way of relatedness that's all very externally oriented. And being Irish, that you have a very big cultural baggage. Not to mention that things are outside of the self that happen to oneself. And not to mention that she's horribly superstitious based upon her mother and relatives who have this kind of worldview. But the notion is that she feels anxiety from an external point of view, when anxiety is always internally, fostered. And when Freud starts talking about anxiety, not before all the different aspects of how anxiety manifests, but just the essence of it, the nature of it. I've always found this to be extremely important because it has immediate application to my work with clients. And that is that the notion of anxiety is a signal that you have, when you're feeling anxiety, meaning the physiological symptoms, like a sudden rush of energy, emotion that comes out of the blue, that hits you, in your embodiment. Often people talk about it in their heart area, their chest, but they could feel it sweating, they could feel it in shaky. Now this is extreme, but Courtney's leg is just flipping like this, her foot is flipping. Things like that we're not aware of. You're playing with your fingers, Pavin, could suggest that you're anxious. But this is how we are. Because it's just how we regulate our affects. But yet, there's signals to us that, whoa, maybe some discomfort is happening, even though consciously we might not even be aware of it in the moment. We're just going through the motions. But when you're attuned into therapy with your clients, their physiological reactions may be communicating something somatically to you that they're not aware of in the moment, but yet whatever you're saying or whatever they're talking about is excavating unconscious types of tensions. So developing kind of a theoretical heuristic around anxiety is, I think, very important as a clinician. For Freud, and again, this goes back to its clinical utility, when you either experience something that you're maybe not aware of, but you just say it's discomfort, whether a client talks about something, that it's often a signal that the sense of self, the ego, feels like it's in a dangerous situation. And that's what Freud calls signal anxiety. The signal is that something's happened, I feel a reaction, or I sense an internal physiological or emotional tension, even though I don't even know what it's about. But we could speculate that we're in the presence of some anxiety-producing effects, whether they be based upon something externally imposed or internally excavated and manifesting itself. So, what does this mean? So, before symptoms emerge, before discomfort emerges, before a person is in a state of upheaval, that usually they have to go through anxiety, and we call that stress. That's the term today. I find it useful to try to, when talking with patients, when they're talking about their stress or anxiety, I want to see if there's an antecedent that they're aware of. Yeah. So when I say, like, well, before you experience that particular symptom or thought or obsessionality or worry or the need to do something about it, what happened today? What comes to mind? If they don't know, everything was fine, nothing happened out of the ordinary. You'll let them have their stream of consciousness, or what Freud calls free association. Their stream of consciousness often will go on about this or this or this. They may minimize it or they may not. But nevertheless, it's interesting that patients who choose to associate about certain things is letting us have some data, even if they don't value it or think it has any currency. In fact, often the time, people will deny something as having any influence on them whatsoever, and that's a sure sign, at least a hypothesis, that they're attempting to engage in some type of denial. So when somebody says, it wasn't this, that's a sure projection of denial as a way of trying to minimize or cover up some anxiety that's hidden. If you were to follow up on the defense, on the negation, and say, I was curious, you said that it wasn't that, but this was spontaneous now. It's not like I'm asking a question, it spontaneously came from their mind, verbally. That almost always tells me there's something going down, that they want to either negate, repress, dissociate from, minimize, avoid. And when you follow up on it, and this is an important part about technique and using your own personality, is that by following up on it where you don't induce a sense of shame or the feeling that they're ignorant of what happened, but that you align with them, and you're more attuned to something, and that maybe we should follow that up together, it often leads to a better outcome. That you're there with them rather than pointing something out that you have some superior knowledge over, and they feel like an idiot. But beside that digression, how do people then develop secondary defenses around their anxieties? So, from the readings, you will see that Freud talks about a number of important elements about how anxiety manifests in our lives, our psyche. And keep in mind, this was like almost 100 years ago. And he's talking about how there are certain desires in us that are threatening for us to accept. I wonder to what degree the psyche has changed since his time, since cultural psychology and since our the way we understand the mind and culture has evolved. But often we will see people divided about, they look at themselves from a conscious point of view in a certain way, such as, I'm a good person, nothing's wrong with me, I'm not crazy, I'm not inherently bad, I want to view myself from the standpoint of my self-conscious awareness as this kind of person. This is my identity. Well, even if it's a persona, we all know that there's stuff inside us that we can't deny. I mean, who hasn't had thoughts that people should die? I mean, that you have aggression, you have animosities for people. In fact, you hate their guts. You wish they were dead, but you wouldn't. But you don't want. You wouldn't say that. So unless you're around intimate people, it's not something I'm going to walk around and tell the world. And then when you allow yourself to have that, unrestrained deluge of emotion, of instinct, of affect, of desire come out, you kind of look rather primitive, don't you? So we often want to keep that stuff in check. Well, there's a lot of people, in the population that don't. They don't have a sensor. They don't have a filter. They don't have a capacity to modulate things, to keep them silent, to keep them into their psyche and their mind, private, solitary. They spew crap, everything. Everything that comes out of them is, it spreads debris. So what do? We have internal agencies that are operative, and our psyche is much more complex. So I can't allow these primitive affects, urges, desires just to spew everything. The ego says you have to contain that stuff. You have to act in such a way as that you integrate into reality with other people. There's certain social expectations that you have to meet, and certain defenses are established in the personality. And not only that, we have certain moral compulsions or penchants or propensities that are based upon certain values and ideals. And those things can be just as brutal as the raw instincts, drives that push for expression. Hence, that's why Freud believed that the superego, it harnesses the intensities and energies of the drives of these base urges, and they use them in a more cultivated fashion. It's to justify our aggressions, to justify our moral contentions. And we see this operative in all forms of civilized, cultivated life. In politics today, where you have the ethics and science, military science, of killing in the name of an ideal. So think how complex it is. We go from primitive man to cultivated man who has to kill. And all of this along is mediated by this poor ego that's in the middle, this poor agency that has to channel between the subterranean underworld and the world of socialization, and yet has to try to meet its own needs and its own desires and wishes for gratification and satisfaction, which it has to suspend because it can never fulfill itself unless it's done through circuitous routes. And hence what we see is the notion of a compromise formation or a conversion in the mind. So you have, let's say for simplicity's sakes, you have two opposing wishes that are battling out with one another. Often you'll have a whole penumbra of conflicts that are coming at you at once in the psyche. That poor ego, and often on an unconscious level, has to mediate between these various factions that are all pressing for their unique state of affairs. And this thing has to mediate between these things, and it says we have to have a compromise here. And the compromise is designed in such a way as that at least some of the energies, some of the anxieties can be released through the compromise. Let's just take the symptom. The symptom is one aspect of a compromise. So one of Freud's case studies, famous early case study, was he used these terms that we would use differently today, but the notion of hysteria, the notion of obsessional neurosis. We don't even use the term neurosis now. Neurosis is anxiety. That's what it is. The common day term. That he had at this time, it's not like today where sexuality is talked about, is evident on the television, and seems to dominate everyone's consciousness. So in his world, Victorian Europe world, talking about sexual matters, sexual details, what goes on in the bedroom, where it was often confined to a certain audience that wouldn't be discussed at the family dinner table. So one of his patients presents herself with many types of somatic symptoms, such as she has a paralysis where she can't get out of bed, she can't move her legs, that she lost her speech, she can't, her vocal cords are not working, she faints, she has temporary blindness, she can't see, at all, and is bedridden. And yet, all organic causes have been ruled out. There's nothing wrong with her physically. And through Freud's, treatment, what comes out is that she's secretly in love with her sister's husband, and she would like to marry him. And this is very difficult for her to admit to herself, so it must be repressed. She's a good girl. She doesn't lust after her sister's husband and doesn't desire after men in that way, especially out of proper arrangements with the family, out of wedlock, etc. Today we would simply call it, lust. It probably wouldn't even matter to people. They would have a thought, they would dismiss it, and it would be considered a fantasy. But it created a complex in her, to the degree that it was channeled into her somatic embodied symptoms in such a such a severe way that she can't get out of bed. Could you imagine? Yes, because there are a lot of people that have conversion disorders today, even though it might be a lot more minimized. We don't see it as often, but you will see it in your treatment of people. They just manifest themselves differently. Symptoms manifest in certain ways. When the patient became aware of her desire for her sister's husband, it manifested in other types of revulsions, need to defend against these types of impulses and desires. But what was interesting is that a particular fantasy was revealed that she had a fantasy about wanting to perform fellatio on her sister's husband. And where did the symptom emerge? She lost her ability to speak. So, here's the psyche kind of at war with itself. On one hand, you have the very location of the fulfillment of the wish, and the superego that punishes it by saying you can't speak. Not only that, you can't speak about it. So the mind, the dialectics that are at work are quite fascinating. Keep in mind, the internal division of the psyche is operating, even though we might not see it. Freud goes on to talk about anxiety in so many different ways.
I'm sorry, can I interrupt just a minute?
Yeah.
Based on your own clinical experience, do you accept Freud's conclusion that compromise formation helps? I mean, to me, compromise formation is the illusion of finding a safe passage, but it doesn't seem a very successful solution at all. I mean, it only lasts for like a second.
Well,
and then it's just, there's so much residue from the failure.
Precisely. What you're saying is true. that the notion is that the symptom emerges until one has mediated the anxieties and internal conflicts and put them into words, that and then one is able to express what they're conflicted about internally, and admit these thoughts or desires or fantasies. And when they start to vocalize them, these symptoms start to go away. It's the whole point is that if the mind is unconscious, if you are unconscious of the conflicts that are fueling the symptoms, then you will sustain the symptoms. And this is why, a psychoanalytic approach has proven to be successful, because it puts a primacy on the notion of insight. And so for instance, the compromise formation in that example, even though it's antiquated, is a good example because it tells us how the psyche can't mediate these internal conflicts, and its attempt at resolution is through a symptom. The symptom is trying to resolve things based upon the internal pressure cooker of different competing desires and prohibitions and counter intentions and need for punishment. And so when a person starts realizing, oh gosh, yeah, that's really hard for me to admit, or that's, it makes me feel like a bad person when I think of myself that way. Or, yeah, I shouldn't have to, I don't want to think of it, but I have to admit it to myself. And then there's release. The pressure valve starts to, be released, and symptoms start to mitigate when the psyche starts to integrate these antithetical forces that are operative unconsciously. So I would agree, with you, Miriam, that definitely I wasn't trying to suggest that this was a solution. This is just a indication or a sense that something's not working. Does that make sense, what I just said? Did I answer your question?
Well, I think obviously in the cases that it presents, it's gotten to the point of pathology. But it seems like in his theory, he implies that if you can stay clear of exaggerated stuff, then we can contain the conflicts and the anxiety.
Yeah, and hence the anxiety has to be channeled, and in this case or in other cases that you'll witness, it's channeled into bodily symptoms. It could easily be that somebody has digestive problems, they have irritable bowel, they have fibromyalgia, they have other types of somatic types of ailments and of depletion. So instead of being clinically depressed, they are constantly fatigued, they are challenged in terms of their energy levels on a daily basis. They might want to attribute it totally to their physiological makeup, but we often think that that's not the case. When people start articulating their internal conflicts that they haven't vocalized. This is important. That often symptoms are based upon a private language. They are interiorized, internalized, and they have to seek expression. They're not content just sitting around in there. You can use certain metaphors of the way the mind works, an energetic metaphor, that there must be certain build-up of tensions that need release, whether it be an economic model of the mind or hydraulic model, whatever the case may be. There's something to be said about it. When patients start talking for the first time about things that have been totally private, they never stated it to anybody in their life, they've kept it in their psyche, in their mind, their own thoughts to themselves, that it's a lot different than when you say it for the first time. When you just say, this is how I feel. And you're there as a person witnessing it, but also have allowed it to happen because your presence is that the patient feels that they can trust you, they can go there with you, that you are safe, that this is a secure space, that you will be there in the psychological holding environment, whatever metaphor you want to use. That is a special phenomenon because not all patients will readily go there. You have to more or less show that you are safe. And once that a person allows themselves to drop their guard, put their defenses down, surrender to the process, that's when they can start opening up to the truth of their inner reality.
Okay, I totally understand the sort of physiological symptoms, right? The conversion, whatever. But the implication is that if you don't have the physical illnesses somewhere, that we're okay. And it seems to me, if I can use a stereotype, it's a very terrible stereotype, but I think of what I call the suburban personality, the suburban housewife that keeps everything just fine and has wonderful kids and perfect house and everything works out, that they are somehow healthier than the person that has symptoms, but you meet them and you feel like there's no person here. So from my perspective, in terms of social interaction, the person that seems to have a good compromise that works for them feels less healthy than the person whose compromise isn't working. They have something showing. So obviously it feels horrible to feel depressed. But if you're depressed, there's something there that you value and that you know it's wrong. And then there are people who I think often talk about normatic personalities who are so normal they feel sick, right? That's John and friendly. Right. Oh, yeah. There's no way that this is healthy. Yeah, so it seems like Freud emphasized and maybe because he was a doctor and that his entree into their lives were that they had physical symptoms. I don't know how
well, I think you're nicely articulating how symptomatology can manifest itself in different contexts. Yeah, I mean, like, this is one example, but what you just simply said, you have the normative, the normalized life that people say we should all have, and they're rather benign. They're domestic. Uh, they're not overly, intellectual or interesting in and of themselves, but this is what people seek. Um, these are the people that come in to us all the time with their own private malaises. Uh, I mean, how you're using the notion of the suburban housewife, of the persona. This is what I should be like as a wife, as a mother, as a family-oriented person who looks at after my kids and my house and my home and all those things. That's in many ways could be our parents' generation, and it could go back to Victorian times.
Right.
And they don't see anything wrong with them. Now, that's how they present themselves to the public. I would wonder on what level, if you get to know them either personally or through your engagement as a therapist, how a lot of other dissatisfactions about this will come up. That when people have a certain fixed identity and this is the way they need to view themselves, they're obviously not allowing other aspects of who they are and their personality to shine forth. And they may, in fact, be anxious in a sense of keeping all those things at bay just so they feel in control of the life that they would like and have formed and have become accustomed to. Wait until something happens to that little world where the bubbles burst, such as hubby has an affair, or kids don't behave like they should be, or whatever external crisis that could happen. But so the point is that the way symptomatology emerges doesn't have to be extreme pathology where you're needing medication in the hospital or something like that, or you feel your body's all out of whack. It very much could be about character development and the way defenses have been built up, that you have a certain type of self-representation of who you are as a person that's very rigid. And that in and of itself is met with, it's fine as long as nothing disrupts that view, but when something either internally or externally or within the system puts pressures on a person's self-identity or challenges their defenses or sense of self, they have to accommodate. And so hence you have internal disruptions that might happen, and compromises have to be forged, or new compromises. What's interesting about the notion of anxiety is that as you have a signal that, like, oh, I'm in a dangerous situation, this is stressful, I have to do something, that people will engage in activities to try to mitigate the stress or the crisis. And when they don't work, we start to feel like our worlds are being shattered, or our lives are being compromised. Then people will develop secondary defenses to try to cope. Often we think of using substances, start using food or alcohol or other types of compulsive activities to try to mitigate the anxiety states. But then, when those secondary defenses don't work, often we see the symptomatology, the clinical things that bring people into crisis or into the consulting room start popping up. And that means that they have failed to find an adequate compromise that shores up anxieties. I mean, anxiety is so, ubiquitous. It's it's really part of our human nature. I mean, who doesn't feel anxious at certain times? If not, we feel pressure on a daily basis to do things. And I'm not talking about, like our privileged group of being PhDs. I mean, of course, you have your pressures in your job, tenure, teaching, family, all these things. I'm talking more about in terms of the masses, or the collective, the social collectives. How do they deal with these basic things that we might take for granted on some level, but in other levels maybe we don't? There are people that have anxieties because reality imposes itself on you every day. You can't meet the bills. You can't satisfy your employer's demands for production. You can't get along with interpersonally with people. Why is it that? Why do people create conflict with others? There are anxieties that are more developmental in nature. Fear of attachment issues, intimacy, fear of loss of love, fear of abandonment from our love objects, whether it be from our parents, siblings, close intimates, to our family, our children. There's anxieties around dependency versus autonomy. There's anxieties around the sense of self or self-experience, where people are constantly comparing themselves to others. They feel inadequate. They feel inferior. Or there's an inflated or grandiose sense of self that they feel superior over other people, but that's compensatory. That, again, it's a compromise. I'm competing because I'm so fucking wonderful over you, you piece of shit. So that type of splitting that takes place. And the grandiosity is so, at times, comical that it could be due to the minor differences of narcissism that Freud talks about. Like, who doesn't compete with people? This is a perfect example but this is a sublimation of anxiety, that you're all academics. Myself included. I'm competing with other people that I would like to jockey for recognition. So that, I would say, is normative and healthy as long as you're not nasty about it. But think about us. We're human beings. We feel slighted. We don't like other people who said this or that or this or that. And this is kind of part of what drives us. The issue around whether we're, anxiety about love, about attachments, about, last week, the notion of loneliness, am I going to be by myself? Am I going to find a partner? This notion of lack, of loss. You have the notion of moral anxiety, guilt, shame, the need for punishment. I mean, this is so integral to who we are. I mean, we don't want to feel shame. We deny shame. Well, the narcissistic defense is I've been exposed about something that I don't want to admit to myself or that others have done, and I want to deny it. And then I want to, in fact, use it as a way of displacing my wrath on this person, and that they're the bad object. They need to be destroyed. It's not me who's inadequate. They should feel ashamed. That's, operative in mainstream, culture. We see guilt less today. We see more shame, or more shame aversion. The guilt is that a person has to, accept that they've transgressed. They've done something wrong. And that in and of itself brings shame, and hence denial comes in. I didn't do anything. It's not me. It's others. Why is it that we live in a world where everyone else is to blame and we take no responsibility for our actions? It's such a horrible, endemic, structural obstacle to being able to recognize, mutually recognize other people. The need for punishment unconsciously is so important. Freud talks about this very well. That when there are these mysterious symptoms, depression, let's say, is a good example. Why is a person depressed? Well, myriad reasons. But, keeping in mind that Freud anticipated modern psychiatry, everything in the DSM would go back to these early psychoanalytic classical masters. Nothing is new. It's a recapitulation of these old categories that have been revamped and based upon, their work with people. Often mysterious symptoms, people suffering, can be due to unconscious guilt. They've denied it consciously that they have any responsibility, but unconsciously there's a backlash. There's a need for a compensation. There is a need for, for a person to be punished. And often it comes out in symptomatology in various ways. A little bit antiquated from the readings that you read on anxiety is the notion of castration anxiety. Particularly, early psychoanalytic developmental theory is quite flawed. But, by today's standards, by the standards of what we know about infant, and maternal attachments in particular. But the notion of castration anxiety is really symbolic for many people, as that they feel certain self-deficits. There's this notion that that you're lacking something, and this fear of being harmed by other people, or you have a sense of body integrity that's being compromised, is also part of like self-development, of a sense of self-development about how do you view yourself. What are your self-representations about? Meaning how you view yourself to yourself. How do you come across to other people? So a lot of people don't want to feel vulnerable. They don't want to feel that they're compromised, that they have any flaws or inadequacies, and there's this hyperinflation, this inflatedness about how wonderful they are. Of course, we see this in the quintessential narcissist who has to display how great they are to others and demonstrate their prowess in every aspect of their life. But these are, again, compromises or compensations for internal conflicts that haven't been kind of like mediated appropriately. They haven't been integrated in the psyche. The person who's aware of themselves are going to say, yeah, I've got all kinds of deficits and flaws. I try to make up for it this way, or I don't like this aspect of myself, so I need to work on that. And you kind of form a bridge about yourself as more realistic than overly one-sided, to use Jung's terms. But all of this is to say is that what I think the centrality of anxiety in the psyche is something that you will see in every patient. It's just the way it manifests itself is going to be different. Is anyone able to apply this reading this week to any of the patients that they're seeing? Well, let me jump in then. A patient in the past who I had seen was talking to me in the session that she had, this is a person who had married a man who was divorced but had a child from a previous marriage. And his daughter lived with the family, and this woman had in many ways a very hyper, if not hypomanic style that many people might even equate with some type of bipolar presentation. She was very animated, always animated in coming to session, very affective, had long embellished narratives, and had a capacity for a free flow of emotive material. She had never been accepted by her mother. Her mother was a very critical person and always devaluing of her in some way, even as an adult, even though that she's an adult and her mother's aging. She had decided that she was going to buy herself a truck. And she decided, I'm going to get this big Dodge, Ram truck, because I always wanted to be in a truck. And she's excited. She bought it spontaneously. She calls her mother up on the phone as she's pulling off the lot and says, I'm so excited I bought this truck. Why did you buy that truck? That was the stupidest thing in the world. You don't need a truck. Living in the city and she immediately started having a panic attack and needed to hang the phone up and pull the truck over to the side of the road until the panic attack subsided. She didn't know she didn't understand what happened. So when she's telling me about it, I'm using Freud's model of anxiety. I want to understand what happened. Why would she become panicky? What went through her mind just before the onset of the symptoms? And she didn't fully know. It's just that the onset of her mother's devaluation and judgment led her to have it. And I said something about of this fact. I don't know if it's exactly what I said, but it would have been of this effect. And it was something like, I couldn't help but wonder if, when your mother was, putting you down and devaluing you when you were having this moment of, of satisfaction, that you wish she was dead. And just as I said that, she started to have a panic attack in the session. So I attended that the best I can to help her, realize that it's going to pass, and that this would be natural. She'd think this. And as she started articulating it more and allowing herself to even entertain the murderous wish, that her symptoms just started to abate right in front of us. Mm-hmm. And that, it's okay to have a thought based upon, but it's different than, to really wanting her to be dead in real life. And mm-hmm. our fantasy life and our conflicts can create these things. And it was amazing to me just how it got shored up just by, I can admit it to myself type of thing. And I of course I don't want to do it, but that type of thing takes a great deal of energy for the psyche, the mind, to keep certain threatening thoughts at bay. And when they are allowed to incubate, and that it's okay, you're not going to act out on anything, but it bursts the bubble, that she realized that she had been protecting her mother from her own aggression her whole life. She can't ever tell her, I don't like it when you put me down all the time. She has to just contain it. And this is what was fueling part of her symptomatology throughout her life. So the person who has to protect the other loved object from their own rage ends up turning it upon themselves as a form of self-punishment unconsciously. And this is a good example of how I think Freud's model of anxiety and compromise formation, made sense in this patient's particular life narrative. If you start thinking in those terms, you'll probably see clients.
What is the application? I'm sorry, finish.
Yeah, go ahead.
No, because I have a patient similar. I think he's so angry at his parents, but he's so scared of that aggression and anger. He idealizes them instead, and he suffers from anxiety. It was one of his presenting issues. But I don't see anything thematic in terms of but more of what you said in the defensive. He gets into obsessional thoughts. But whenever it comes to talking about his parents, he even begins to express, he can't express a little anger at them. Because I think he's really angry at them, but that's just so incredibly, I don't know. I'm wondering about that whole, what is it? I don't know if the death instinct or whatever, the idea that his aggression will kill them, that it won't hurt them. Or himself. I don't know yet what she's feeling. But it was just making me think of him while you were talking, because he just can't express it. But I'm thinking in terms of that, actually, he doesn't complain that anything is bothering. He does complain that all those excessive thoughts and a lot of anxiety. So I don't know if that also.
No, that's a great example too, because obsessionality are attempts at abating anxiety. So, I'm going to go through everything in my mind, rethink things, try to reorder things, and that's our yeah. I mean that's the way of abating or neutralizing or alleviating anxiety for the moment. But the anxiety always comes back.
Yep.
And if your hypothesis is correct that, I can't tolerate any negativity directed toward my parents, or I have a hypersensitive need to protect them, that they're idealized and fine, they've done nothing wrong, that's a very good indication that the defense is dissociated, and that it's not, it's operating autonomously to protect him from his own, feelings of acknowledging his hatred and rage toward his parents. But from a technical point of view, having made many blunders, it's best not to overly interpret these things, but to let them play themselves out. He has to come to acknowledge and integrate his own aggressivity and metabolize it, in bits at a time. Because if you simply say, "Oh, you have this hatred,"
Yeah, no, and I never have.
But if the goal, if you're correct as a therapist, saying that you think that a real complex here, a conflict, is that there is a lack of an ability to acknowledge in yourself that you have hateful, aggressive feelings toward your parents, and that you need to protect them from your own rage, and that you're turning that on yourself in the form of obsessionality and the need to view them in an idealized way, then you're more or less saying that pattern of defense or denial or dissociation or compartmentalization of affect or whatever you want to say ultimately is not going to work. And slowly over time, a person could come to realize that, there are these things I don't want to admit, but I kind of need to, so I can reconfigure my image of my parents, not in a one-sided or split-off fashion. People who idealize their parents, I had the best father, mother ever, I never had nothing happen as a child. They have limited memories growing up. These are the people that have spent a great deal of internal energies and fantasies staving off that conflict. It's threatening for them to think other ways. When, an integrated personality is that, I see my parents now for what they are as an adult. They weren't, as a child, I viewed them this way. And it could be the opposite. You viewed your parents as horrible people, and you have symptomatology and suffering and a pathos because you overly vilified them, and you didn't see the good things that they had to give because you're so fixated on the negative, and that sullied your representations of them, or object representations in the literature. a more integrative view is like, this is the good things my parents had to give me as a kid. I appreciate that. I love them for that. Here's the shitty things they did. And now as an adult, I see them, as just human beings. I don't see them as idealized or horribly devalued, but they're just, this is what it means to be human. And that often helps people. People who hold on to this sense of entitlement, that I was never given the perfect love or whatever I wanted, I deserved, and I'm going to hate them for the rest of my life, is kind of living, in a fantasy, an infantile fantasy world. They haven't given up the wish, and they haven't mourned their parents as being, normal human beings with flaws, with deficits, like we all have. And some people will rigidly hold on to a certain representation that only if I had this given to me, I'd be different now. Oh, I have so many people that are that way. Like, their life narrative is, I suffered, let's say, maternal deprivation, or my father was never around. He was a workaholic. Daddy was never there. And that's kind of like a reason to hate them. And a reason to kind of recapitulate through repetition compulsions this feeling that they can never transcend the fact that there will never have been and never will be a perfect state of bliss. So the fantasy, like, only if I was given this, I would be a different person today, has to be addressed at some time in the analysis. The blame is always external. I've been deprived something, or the person who says, this person's done me wrong, they traumatized me, whatever the case may be, needs to fixate on that rather than allow themselves to, transcend that and look for other ways of healing. Again, it's hard to make generalizations about these things, but it is something you'll see over and over again. Well, I noticed that I've been flapping my gums again. I hope you'll stop me, ask questions anytime. And do you have any thoughts now? I always like to be mindful of what class wants or desires. Do a lot of your instructors ask you to present cases?
In the second year, this is because I flipped years. We did present cases in every class because we all had patience. But because not everybody has patience this year, they're not. But one thing we did, I'm just throwing it out there, in case people want to do it, is when I didn't have a patient yet, I used literature. And I really cared about literature. Yeah, and so did me. It was really fun. So I'm just throwing that out there in case that's something people are interested in, but you don't have patience.
Normally we have friends, hey, the two of us, and then you guys have to keep them.
So I presented Holden Caulfield last year. He's depressed. But anyway, so I'm just throwing in case people, I don't know if people want.
Did you want to suggest that?
Well, again, I really like to cater it to what, what the class wants. So if you want me to lecture like I have been, or if you don't like the way it's going, you'll give me feedback. If you'd like to do something different, you can always send me an email too if you don't want to tell me, in front of everybody. I just want to make sure that I'm addressing your expectations. I think that, I'm starting with the classical literature, and we're going to be moving very quickly into contemporary discourse. And I hope that you'll see how things blend, and particularly when we start talking about forms of pathology, character pathology in particular. Very, there's a lot of different ways of viewing it. I have my own way, and it's only mine, and it's. I like to be challenged too. So there's something you don't agree with. I think I liked, I like Miriam's, wants to challenge it, do it. I think that's how we learn. So especially if things seem to be antiquated or don't match your experience of things. Okay, well, thank you very much, and nice to see you all. See you next time.